Nowadays, we are seen in the news or everything. A person suddenly downfall, then he is going to die. Why?
That's what this is called as cardiac arrest.
Okay.
So what has happened is, most of the time, 80% of the time, 80 to 90% of the time, they have heart attack. Heart attack is so severe that heart start pumping normally. Normally heart pumps 60 minutes per minute, like
Okay.
this.
Okay.
When suddenly 100% heart is blocked, the heart muscle supply, blood supply to the muscles totally stops. So instead of heart beating here, it beats like this.
Okay.
It's called as ventricular fibrillation. It is fibrillating.
Okay.
So it cannot pump effectively blood to the body. If you start beating like this, immediately blood supply to the brain stops. If there is no blood supply to brain for more than 1 minute, they will become unconscious. So this is a medical emergency. So few things. One is you have to call ambulance. Next is, if you have in a place like airport or something, there will be defibrillator will be available. If you are, there's a automated defibrillator that's called as AACD. So you just apply the patch and the machine will tell whether to give shock or not. That you can do. Another is, if you know cardiopulmonary resuscitation, you can do cardiopulmonary resuscitation. Then once medical people comes, we have to do CPR. Medical people will do CPR. Once they stabilize, they will shift immediately to hospital. If it is heart attack, they will do primary angioplasty.
Why these are going to seriously for heart? Is there any precautions or what to do? The patients are normal peoples.
Okay, currently in current scenario, any people more than 20 years, they are getting heart attack. The issue is, we do all tests normal. Patient will come to OP after 40 years. They say, I have done sugar, I have done cholesterol, everything is normal. Why I am getting heart attack? So what is the current scientific thinking is, even though everything is normal, your body can have underlying inflammation. They can have even normal cholesterol. It's important is how long the cholesterol is elevated, when it starts, whether you have risk factors like sugar, BP, any family history is there, you are smoking or not, all this has to be taken into consideration. So previously, for any people, normal people who comes for general checkup, we do this routine checkup. Now currently the thinking is, we have to, for routine checkup, we have to do some more advanced tests that are available. One is CIMT, carotid intimal medial thickness. That is means, in the blood vessel which is supplying the brain, there will measure the thickness of the artery. Normally it should be very thin. If you have plaque deposit here, it will be very thick. So that we can measure. Another is coronary calcium score. Coronary artery, we can measure calcium. Another thing is CT coronary angiogram. So all these are screening tests which can be done in person who is normal more than 40 years. If they have family history of heart disease, if they have risk factors like sugar, BP, cholesterol, smoking, anything, they have to do this test. They should not stop with sugar test, cholesterol test, this. If this test shows abnormal, say calcium score is very high, say there is a plaque in the carotid artery, we have to give treatment. So treatment is, if cholesterol, first is lifestyle modification, very important. One 40% patient comes, you test, you find something in the abnormality in the carotid artery thickening, or calcium score is high. First thing is, lifestyle should change immediately. Next is statin, cholesterol drug, they have to start, even if its cholesterol level is normal. Next is BP, even if BP is borderline, they are supposed to start on BP medication. Then another thing is, for preventing heart attack, they can give aspirin. This is called as primary prevention. Before heart attack, you give some medicine to prevent heart attack. This is called as primary prevention. So which patient has to give blood thinning agent? If you do this test, you find before you having heart attack, you can give all this, take all this measure to prevent heart attack.
Doctor, must and should do every man to do all this test compulsory?
It's not necessary to everybody has to do this test. Current thinking is anybody more than 30 years, if they have family history, if they have risk factors like sugar, BP, smoking,
Okay.
family history of heart disease, obesity, all these are risk factors. If they are more than 30, any risk factors, we have to do this test.
We are listening a lot of cases doing stunts. What is the meaning of stunt? What they functioning?
Okay. So, how heart attack, heart blockage starts? So, it doesn't start in a single age. It starts by 20 years. So, normal artery, normal thickness. As cholesterol level maintains for long year, slowly deposit cholesterol deposit in the artery. It starts by 10%, 20%, 50%, 70%, then 100%.
Okay.
So now the stent is useful only if you have heart blockage more than 70%. For 100% heart attack, this is treatment of choice, life saving. For more than 70 to 80%, if patient is symptomatic, it is useful. In other blockage, if patient is asymptomatic, stent is not useful.